distinguished dignitaries on the dais, Dr. Agrawal and his colleagues, members of the Indian Medical Association. For me, it's a privilege to be amongst such an august gathering. And I often joke with people that it's always makes you feel great when you have such a knowledgeable lot of people before you and you are asked to speak. I'm the only person perhaps who would not know much about the profession that you are in. But, oh, you are there, yeah. But we are here, and it's a privilege also because what we are talking about today rests squarely on your shoulders. Pardon me, because normally orations, as they technically and formally go, are to be read out from a written script. With your permission, I feel very uncomfortable with written scripts, so I would like to share some of my views with you today. To begin with, I really don't know why in all such gatherings we do discuss the relationship between government and IMA. I really don't know if there is a difference which we must discuss every time. A professional body which really is carrying on the work, whether it belongs or does not belong, is a part of government. You can't think of healthcare delivery without this. Professor Agrawal said that it's a marriage. Yes, indeed, it's a marriage. Fortunately or unfortunately, it's an arranged marriage. And as with all marriages, even if you have a bad marriage, you have to live with it. And try all the while that you make better of it. So it is with this focus of working together as partners that I would like to place some issues before you. First and foremost, the topic that has been chosen for today, relating to affordable health and sustainable development goals. There could not have been a more appropriate topic for two critical reasons. First, that it indeed is alarming that the cost of care in this country over the last 10 years or so has increased by 400%. Therefore, it is apt time that we start discussing the issue of affordable health care. And secondly, this is also very critical and important today because if at all health care has to be made affordable, this is the community that is going to do it. So we are talking to the target audience which will actually translate this entire vision of affordable health care. Therefore, this topic is very critical. But before I really set out to spell out what affordable health care would mean, let me place before you what the vision of health care is and why it has to be built in partnership with both the professional organizations and the government. You look at the Indian scenario of healthcare. What is it that we are aiming at? We really are aiming at accessible healthcare, affordable and quality healthcare. These being the basic pillars of healthcare, all policy formulations will have to be woven around it. I was talking about in the topic assigned today about the Sustainable Development Goals. Till about a year back, our limited focus was on the Millennium Development Goals. It's actually a journey, and we have had two legs of journey. We traveled till December 2015 with the Millennium Development Goal, and the second leg of journey starts today to end in 2030. Much of what will happen between 2015 and 2030 is actually an unfinished agenda. And that unfinished agenda has to be taken to its logical conclusion. But let us look at India's basic indicators before we talk about affordability in healthcare. India as a country has done rather well when we talk about reduction of, let's say, IMR or under 5 mortality or MMR in the country. Let me share with you that the recent survey shows a drop of 4 points in under 5 mortality in 2014, which never happened before. Or for that matter, yesterday's survey report on IMR shows a drop of 2 points in 2015 compared to 1 in 2014. So we are doing well, but still we carry the largest burden of this mortality. And we still managed, unfortunately, to lose 44,000 to 45,000 mothers every year and close to 11.5 lakh children. 10 lakh of which die in the first year. This should be a cause of worry not just for government. It should be a critical cause of worry to the medical community, because it squarely lies on their shoulders to take us out of this. Somehow or other, in medical meetings, etc., whenever we talk about IMR or MMR, we restrict ourselves to mortality. I, for one, would like to move beyond mortality. It's not just about survive. We need to look at the whole cycle of survive, thrive, and transform. To give you one example, even if we are controlling mortality, are we really building a healthy India? That is the question we should be asking ourselves. With 38% of our children being stunted, 15% wasted, and 29% underweight, even if they are surviving, are we really building a healthy society? Is that the real target that we have set out for ourselves? Is it also because we have not been able to make healthcare affordable till date? I'll give you one very simple example where I actually appeal to all of you to help government. We pride ourselves on our traditions. The common perception is that every child in this country is breastfed. But when you do an analysis, the total breastfeeding in this country is 46%. So we were on a critical issue that very basic things like breastfeeding, we have not been able to communicate to mothers how critical it is. And I have no hesitation in saying many a times we are the cause of what is happening. We need to get out of this syndrome. You really are the pillars of success. When you win, we will win this battle. If you don't win, we will never win this battle. So our policies should be framed at enabling you to win this, because you must emerge as the winner. One very critical and major thing that the National Health Mission has taught us is partnership. If you look at the success of the National Health Mission in this country, the critical element has been partnership. It has been partnership with external agencies, partnership with field level workers, and greater participation with professional organization. Today, when we are doing the Pradhan Mantri Surakshit Matritva Yojana, Foxy is leading it. We are not leading it. Tomorrow, if we want to do a healthcare delivery system in the rural areas, it should be IMA which should lead it. We as government should just back it. We should provide the enabling infrastructure and the platform. That is what is critical about partnerships. We all talk about health for all. One new element that I would like to introduce is health by all. Unless it's a joint effort, it can never be an effort of the health ministry again, and should not be the effort of the health ministry alone. You are the critical players, and we really look at you for this. One more element before I come to the affordability of healthcare. We always, whenever we talk about the healthcare delivery system in the country, we always talk about the loopholes and the problems that we face in the healthcare delivery. As a nation, we have forgotten to celebrate success. It's no mean achievement what your effort has brought about in change in IMR or MMR. For that matter, whether it was polio or neonatal tetanus, or now yours, or by the end of the year it will be Kala-Azar and filariasis. These are all successes. But whenever we talk among ourselves, we do not celebrate success. Unless we start celebrating this, we will not be able to encourage our field level functionaries to really go ahead. So we have to keep that in mind, and you carry the largest burden in this. If you look at the Indian health sector, policy planning in India is extremely challenging and complex. The demographic, the epidemiological transition in the variety of the population and the largeness of the population pose a very, very strong challenge. What do we base our policy on? We base our policy on the fact that in India, we have a low public spend, we have very weak intersectoral coordination, high out-of-pocket expenditure, weak public health system. These are the factors which actually formulate our policy. But in the Indian context, one critical element which kind of hinders our effort at providing affordable and accessible healthcare is inequity. Inequity in geographies, inequity in populations. Within a state, inequities among districts. So what happens with these inequities is that policy formulations become that much difficult. 8 states in this country contribute to 87% of the maternal deaths. So that is the kind of inequity that we are talking about. So there can never in India be a one-size-fits-all policy. It has to be a focused policy. And when we focus policies, the other issue that crops up is the inequity between urban and rural areas. It's been a constant refrain and a complaint which we keep having with each other that we do not get doctors for rural areas. I do appreciate the challenges. Infrastructure is weak. After having spent so many years in hard work, going to such a low level of infrastructure is difficult for doctors. The issue is, while we all acknowledge this and appreciate this, no third person from outside is going to find a solution to this. The solution has to be found within this audience. And therefore, I say that we cannot leave it at mere discussion. We will have to together move forward and find a solution to this problem in policy making. If you look at the Sustainable Development Goals, we say that we'll reduce MMR to 70 by 2030. Presently, we are at a stage of 167 in 2013. If you do a proportionate projection, 2015 we would have reached the Millennium Development Goal of 141. We should have done that. If you look at under 5 mortality, as I mentioned to you, a 4-point drop means that we will certainly reach the Millennium Development Goals. On the other hand, if you look at these achievements in population stabilization, 21 states, or rather 23 as of now, have already reached the replacement level of 2.1. What does that show? It again shows the same thing, that the inequities in this country are actually holding up progress. And what we need to do is have a more focused approach, and as service providers, the medical profession needs to reach out more strongly in these states than ever before. I would like to assure you that whenever this kind of effort in these selected states is made, government will solidly stand behind you. Infrastructure is ours. Please come and help us. When we made out an appeal 2 months back for gynecologists to help us with antenatal checkup on 9th of every month, every day we are getting several registries on our website saying that I want to volunteer. That is the kind of spirit that this country needs. And that is, fortunately today, the kind of spirit that is building up between us, which will take us forward. Coming back to the issue of affordability of healthcare, it is a rather sad story in Indian healthcare delivery that the cost of care has gone up so much that close to 7 crore people slip into poverty because of illness. And this is essentially because 60% of the total expenditure that people make in healthcare is out of pocket. Out of pocket is an expenditure where the government doesn't subsidize or the insurance doesn't fill up. So that is the kind of scenario that we are facing in this country, where 60% is going out of pocket. And that is the crying need why we need to make healthcare affordable in this country. Universal health coverage is one of the overarching target in Sustainable Development Goal, and I'm happy that we are committed to it. But if you look at the perspective from the other angle, 70% of the out-of-pocket expenditure is on OPD. And 70% of that OPD expenditure is on drugs and diagnostics. And 70% of the people actually go to the private sector for OPD. 70% of the people are availing OPD services in the private sector. So if the cost of care is high, we together need to sit and think, what is it that the rising expenditure means? Even if today we fully implement the free drugs and free diagnostics program in every public health facility, there will still be an issue because 70% is going to the private sector. That is why I say that we will have to together work out a system where we can actually reduce the cost of care. Primary care provisioning in this country so far has been limited to maternal child health services and partly communicable diseases. But the new arising challenge of the non-communicable diseases is to be squarely faced by all of us present here. How do we do health financing is the issue. There are several ways we do health financing, and that is where we need support. Because to meet medical care cost, if we believe in out-of-pocket expenditure, that according to me is the most regressive way of financing healthcare. So to finance healthcare, we need to pool risk and have prepayments. Many countries in the world, you take New Zealand, you take Canada, Thailand, Turkey, and the UK, for example, and many European countries, have this concept, and they are providing it through the public system. The problem with us is that while public healthcare system is very important in India, it is actually catering to only 30%. So how do we do this? Naturally, the entire burden lies with you professionals who are, some of you are in the public sector, but many of you are in the private sector, where we will have to work together to do this. Because the other extreme of insurance, we keep talking about insurance coverage. With all the efforts of all these years, the coverage is only close to 15%. So we are nowhere near that. So our health financing systems are weak. I would propose 4 ways how we can reduce out-of-pocket expenditure and make healthcare affordable, at least, or actually, in the primary healthcare system. First, shift primary healthcare from communicable diseases to non-communicable diseases as well. The focus must shift. Second, let us go in for a country-wide free drug-free diagnostic drive. Third, and it's critical as far as you are concerned, I'm making an appeal, let us today commit ourselves to promoting generic drugs. That is one certain way of cutting down expenditure which is out of pocket. And, since the private sector provides 75% of the care, they should be able to push this national agenda of actually prescribing generic drugs to people. And then we will see a certain decline in the out-of-pocket expenditure. The other way to do it, fourth way, is to actually focus on preventive and promotive health so that tertiary healthcare expenditure comes down. The probability of dying during the most productive years, that is 30 to 70 years, from one of the four NCDs is estimated to be 26% in India, which is the highest in this world. NCDs contribute about 37% of the total out-of-pocket expenditure that we are talking about. Therefore, unless we are able to shift our focus, the healthcare cost is unlikely to come down. I have one issue here which I would like to share with you. As a nation, we need to sit and decide, what is the health policy that we want? Do we want healthcare or do we want hospital care? There is a very critical difference, ladies and gentlemen, and I would urge Indian Medical Association to give it a serious thought that between hospital care and health care, which is the most critical thing that India should choose, given its resources, given its expense. The other major contributor, as I said, is tertiary care and secondary care, which is actually catastrophic expenditure. And this catastrophic expenditure, somehow or other, will need to build a system where we can actually bring it down. And as I said earlier, insurance cannot be the only wheel carrying this message. We have to bring in other issues like this. If you look at the entire scenario of healthcare in India, there's a very sound basis for building an approach to affordable healthcare around comprehensive primary healthcare. That goes beyond, as I mentioned earlier, beyond maternal child health and communicable diseases. This is because, apart from everything else, comprehensive primary healthcare is value for money. We get higher health outcomes at lower per capita total health expenditure if we go for comprehensive health care. This would also reduce morbidity and mortality greatly at a cost which is much lower to the system and to any individual than any other approach, and would significantly reduce the need for secondary and tertiary care. That is why what we advocate is a very strong promotive, preventive primary health care if we really want to build a good health structure in this country. One of the critical elements which lead to all the problems in the healthcare delivery is human resource. We are all aware of the acute shortage of human resource. There can be many ways of doing it. There can be ways of increasing the number of doctors. There can be ways of ensuring that geographical skewed distribution of doctors is taken care of. But I don't think at the end of the day, that is what is going to help. What is going to really help is if we add to this pool. And this is where today I would like to raise with you an issue which has been somewhat contentious. Contentious in the sense that this issue has actually drawn the attention of everyone, but we have never come to an understanding on this issue. And my primary request to Indian Medical Association is, you may throw this idea out, but please don't throw the idea out without considering it. If you look at the structure of healthcare in India, the lowest level of service provisioning really does not require an MBBS doctor. It's a very basic ambulatory service that we are providing there. Therefore, if we had adequate number of doctors in the country, there was no reason why a doctor should not have been there. Since we have a 30% shortage, even in the public health system today, why can't we accept the fact that there are other streams which can actually coexist? Why can't we get to understand that since we cannot deliver at certain points, if there are other competent people who with some training can deliver, we let us allow them to deliver? Why can't we accept the idea of mid-level service provider? As I said initially, This is a contentious issue. The Indian Medical Association has on many occasions been in opposition with our views. I would still reiterate that before you reject the idea, think once. Wherever you can provide, it is the greatest service to the nation. But wherever you can't provide, why can't we use alternatives? Let us have a thought on this. The other issue which as an association you need to address is quality of care. Quality of care, including hospital infections and what have you, is very critical. Even in our routine services, labor room protocols are not followed. So you have a high number of sepsis deaths. Immunization protocols are not followed. So you have the after effects. Quality of care is critical to any delivery system that we create in this country. And without that, we will not be able to survive. But it is not just about medical quality of service that we should be thinking about. For a patient, equally critical is empathy. Pardon me for saying this, but there is a perception in the country as well as outside the country that the quality of healthcare delivery in India is not the best. The service is not the best. We all try and do our best, and you have been shining examples of medical proficiency and excellence. But there is this criticism. My appeal to you is that if there is this perception, rightly or wrongly, let us not immediately get into a denial mode. The only way we can solve a problem is that we first and foremost recognize the problem. If there is a perception, there is a need to work on it. I see no reason why we should always say that this is not correct. Let us work together on actually a quality service which people will remember and talk about. Healthcare sector is really growing in this country. And if you look at the industry estimates that we have for this country, it will reach 160 billion US dollars by 2070 and 280 billion dollars by 2020, which is a huge jump. This is very reassuring. But we must also remember that growth has to be inclusive, and we have to ensure that nobody is left behind. If we really want to move in affordable care towards SDGs, I think all stakeholders will have to partner in this to ensure that this is completely inclusive growth. Affordability of healthcare is also impacted by the cost of care in the tertiary sector, in the private sector. And it's a fact of life. Many people question what is the role of the private sector. Is it only for profit? I personally feel that if we cut away profit completely from the private sector, the sector will not survive and thrive. We need the sector to survive and thrive and have a vibrant growth. But there has to be justification about the profit seeking. You cannot afford to use your excellence, use your proficiency and cure a person of the disease that he came to you with and inflict the disease of poverty on him so that he goes back and suffers for the rest of his life. As a social mass, I think we cannot afford to do this, because we are all responsible citizens and we must move towards making a very healthy nation. And one of the primary pillars is that we make do with it in the basic minimum that is required to do it. And it is time organizations like the Indian Medical Association, which are a backbone of the entire health delivery care system in the country, sit and deliberate on means and ways of cutting costs. The answers actually lie within you. The problem is that we are not asking questions to ourselves. The day we start asking questions to ourselves, we will find the answers. So let this occasion be an occasion of starting to ask questions to ourselves about whatever we are doing, which either perceived or in fact is not what we should be doing. I'm sure you will be able to find answers for this. Ladies and gentlemen, I am just leaving these thoughts with you on the table, hoping that we will interact more on it and find a solution to some of these problems. Because at the end of the day, we may meet sustainable development goals, but if we are not able to get to affordable healthcare delivery system and a proper channel in this country, we will not really be delivering to the people. And I again say that healthcare is not a business of the health ministry alone, cannot and should not be. It is our business and we need to work together. So if we can sit and think of a strategy which we can really enforce together, we will one day see that healthcare not just becomes affordable, but also all-inclusive, and the vulnerable sections will be covered by it. Thank you very much, ladies and gentlemen, for having given me this opportunity to talk to you this evening. Thank you.